Good afternoon, everyone, and thanks for taking the time to join us today from the Legislative Building in Regina. We have Health Minister Paul Merriman, as well as Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. As well on the line, we have SHA CEO Scott Livingstone. We'll open with remarks from Minister Merriman, and then we'll go to Dr. Shahab, and then we'll take time for questions. Minister?
Thank you. Good afternoon, and thank you for joining us here today. I want to express my deepest condolences to the family and friends of those individuals that have passed away over the last few days due to COVID-19. The loss of a loved one is painful at any time of year, but it must be especially difficult during Christmas. We are very sorry for your loss. Today, I want to thank everyone in advance for following all the public health orders and guidelines during Christmas and the holiday season. I know this is not the Christmas that we all want to be spending together. Each year at Christmas time, we all look forward to getting together with family and friends, visiting each other's homes, sharing a meal together, or just standing around the kitchen and socializing. Some of us travel long distances to be with our families. These are all things that make Christmas and the holiday season so great. But this year, these are the activities that could make Christmas very dangerous, that could lead us into a huge spike of cases a couple of weeks from now. So we are asking you, stick to your own household for Christmas. Connect online with other family members and friends. Visit outdoors if you can. Have a quiet Christmas. What we are doing is making a difference. Our case numbers, while still higher than we would like, have started to drop. Today, our 7-day average is 217 new cases a day. That's down from 263 a week ago. So what we are doing is working, but we have to keep doing it. Household contacts are still one of the main sources of transmission. So we know that large gatherings at Christmas would almost certainly result in a large spike in cases. 2021 will be a much better year as we get more and more of our population vaccinated and life begins to return to normal. This is already underway. As of yesterday, 1,519 vaccinations have been completed at the Regina General Hospital. They should be through the initial delivery of the 1,950 doses later this week. Also, yesterday, we received another 1,950 doses in Regina. These will provide the second shot for those who have received their first shot. That will take place 21 days after the first shot. So soon in the new year, we will have our first Saskatchewan residents who are fully vaccinated against COVID-19. Pretty remarkable when you think about it. Also yesterday, 3,900 doses were delivered to the Merlis Belcher Place in Saskatoon. Those will be used to deliver both the first and second shots to 1,950 Saskatoon healthcare workers. In addition, more doses will arrive in Saskatoon next week, enabling a further 487 healthcare workers to be immunized. The second dose of this vaccine will be administered to the recipients within 3 to 4 weeks. In fact, I understand the first shots in Saskatoon are occurring right now as we speak. We also expect 3,900 doses to be delivered to Prince Albert in the week of January 4th, and then regular weekly deliveries to our province after that. Those are just the Pfizer vaccines. We also expect the Moderna vaccine to be approved by the federal government in the coming days. And those shipments should begin almost immediately after that approval. The first Moderna vaccine will be given to the residents and staff of our long-term care homes and personal care homes. Planning is already well underway for these next allocations. So we can really begin to ramp up our vaccinations early in the new year. As soon as the vaccines arrive, They will be administered to Saskatchewan people quickly, safely, and efficiently as possible. I want to thank everybody involved for this massive effort. Saskatchewan has a great track record when it comes to immunizations. So when the vaccines arrive, we will be ready. Finally, I want to say Merry Christmas and Happy Holidays to everyone. Again, I know this is not the Christmas we wanted. I can assure you, there is no one in our government who would be asking you to do this, to spend Christmas this way, if it wasn't absolutely necessary. But it is necessary. It's necessary to protect ourselves and our loved ones. It's necessary to keep our case numbers under control. And it's necessary to help us get to the finish line that will happen sometime next year. When a significant number of Saskatchewan people are vaccinated and life starts to get back to normal, 2020 is going to be a quiet Christmas and New Year's. But 2021 is going to be a way better year. In spite of everything, we are still blessed to live in the best province, in the best country in the world. It will get better, and we will get through this together. Dr. Shahab?
Thank you, Minister. So I'll maybe just reinforce some of the comments Minister made, and just to reiterate that, our numbers are seeing a downward trend, and, new measures are put in place, but really the credit goes to everyone in Saskatchewan. I think, everything has been calmed down, slowed down, and our numbers are showing that. So I think that's very reassuring. 7-day average of 217 cases per day, 17.9 cases per 100,000. We still have 124 individuals hospitalized and 21 in ICU. So hospitalizations are also not trending up, and it will take some time for them to start trending down, but we're already seeing some positive movement there. Our daily test positive rate is also coming down at 7.9. So again, there's some positive trends on all indicators, and so it's really important to sustain that downward trend for the next 2 to 3 weeks. But we also have to remember that unfortunately we still continue to see deaths due to COVID-19. So since Friday we have had 20 deaths in Saskatchewan. So I would like to join the Minister in offering my condolences to individuals and families and friends of those who have passed away, as well as their caregivers in case of deaths in long-term care facilities. And again, I think, obviously, like the Minister said, this will be a different Christmas, but many people have made plans to remain connected with friends and family in Saskatchewan and other parts of Canada and the world. If you have friends and family in the community where you live, many people are planning to be outdoors. It seems to be, the weather seems to be not that bad, so you can go and meet and greet people from a distance outdoors in groups of up to 10. Otherwise, it's so important to be out and about, weather permitting, for physical activity, for your own mental health and wellness. And it's so important to check in with friends, neighbors, family, either virtually if they live far away, or maybe just knocking on their door and saying hi without going into their house. That physical connection while maintaining physically distant is going to be so important over the holidays. So with that, I'll join the Minister in, wishing everyone a Merry Christmas, Happy Holidays. And I agree that, I think Saskatchewan has done really well over the last 2 or 3 weeks, and once again bending a curve downwards. We really need to sustain this course as the vaccination program picks up, and hopefully we can look forward to a better 2021. Thank you.
Thank you, Minister. Thank you, Doctor. We'll now open up the phone lines for questions. Operator, can we have our first question?
We have Nathaniel Dove with Global.
Hi, can you hear me okay?
Yes, Nathaniel, you're good to go.
Thank you. So Nathaniel Dove from Global News here. This question is for both the Minister and Dr. Shahab. I'm wondering what the province and SHA is doing to test for and look for the new variant of the coronavirus, the one that's mutated in the UK.
Yeah, thank you for that. So we have been in daily contact with our counterparts in Canada and the federal government, and our Roy Romanov Provincial Lab has confirmed that they can indeed process samples for screening both in Saskatchewan and with the National Microbiology Laboratory, of any case which may have been linked to travel to the UK. So far, we have no evidence that we have that strain in Canada or Saskatchewan, but we will continue to monitor. And obviously, the federal government put in some travel restrictions on Sunday, and they will continue to be reviewed. But we routinely follow up with our public safety, Saskatchewan Public Safety Agency. We follow up on all travelers who come to Canada, including persons from the UK who do stay in 2-week quarantine, and if they were to become symptomatic or had any concerns, they can seek testing. So we have a very robust system in place to, check for any risk of importation from the UK. And we look at strains in a regular basis when there's outbreaks or other transmission trends that are concerning. So we are well positioned to monitor that. But also I would like to add that early indications suggest that although there is a concern in the UK, it really for us it means that there's no change to what we need to do, stick to our households, maintain physical distance, mask use, hand hygiene when out and about, and there's no impact on the vaccination program either. Thank you.
Do you have a follow-up question, Nathaniel?
Yes. So in Saskatoon, there's been outbreaks in the police service and some paramedics. There's talk about firefighters helping out in prisons, the staff there. Are there any plans underway, or at least any discussions to bring in other services from the provincial level or potentially the federal level, and I'm thinking of the Army here maybe, to help if more first responders in the province get infected?
So maybe I can make some initial comments, and maybe Scott may have some additional comments. So, I think we have to recognize right from February, our essential workers have been on the front lines, healthcare providers, first responders, fire, police, EMS, and others who have been continuing to provide essential services. And as our community transmission has gone up, we have seen increased transmission in police services, fire, ambulance, and in correction staff, as well as inmates. Corrections have been managing outbreaks, have been working with local public health, managing staffing, and we had some clusters early in the spring, but with increased transmission, they are managing the staffing in those areas. Further, comments can be solved from the specific sectors as well, but I'll just see if Scott had any specific comments. But from what I've heard from my medical health officer colleagues in Prince Albert and Saskatoon, corrections is managing those clusters. They're managing the staffing as appropriate, because obviously if you yourself are ill as a staff member, you have to stay home for 10 days. If you're a close contact, you're assessed by public health and may have to stay home for 14 days, but so far it is being managed.
Maybe if I could just before that, I think this is why we've been, the SHA has been talking for the last couple of weeks about service slowdowns across the province, and that we've been pulling staff. Anytime that there's an outbreak, we have the SHA staff immediately on site to be able to backfill any positions that might be down if it's within our medical system, or just to advise and consult on a path forward to make sure that things are contained and make sure all of the public health guidelines. So last week we did go through this, that we are having some service slowdowns across the province for exactly this reason, that we are able to allocate the right people to the right places for the right time. And that also includes the people that we're going to be utilizing in the system to administrate the vaccine. This is a huge undertaking with the SHA, and we want to make sure that we have the people ready to be able to administrate that vaccine as soon as the vaccine hits our soil. So I don't know if, Scott, if you had anything to add?
So the only other thing I would add is that as Minister and Dr. Shahab have already pointed out, the public health care teams are directly involved in outbreak management and consultation with corrections. The other thing that's ongoing is work around bringing point-of-care testing to corrections facilities. We've done that in Saskatoon, or to some extent, and we are talking to corrections about making that a broader application to help support outbreaks and managing virus transmission in the correctional facilities.
We'll take our next question.
We have Heidi Adder with CBC.
Good afternoon. This is Heidi Adder with CBC Saskatchewan. As was mentioned, My first question is, how will gathering restrictions be enforced over Christmas Eve and on Christmas?
Maybe I'll touch on that one first, Heidi. I think one of the successes that we've had in our province is that the Saskatchewan people are doing an amazing job of compliance with the public health orders. We have some people that are not adhering to that, and again, we encourage them to comply with the public health orders that are out there, review them, find out what is allowed and what is not allowed. We will continue to work with the side of compliance to make sure that that's our number one priority. If people are not complying, then that's up to them if they want to make a phone call to be able to do that. But again, I really trust the Saskatchewan people to be able to comply with what's going on. They understand that this is for their safety, their neighbors' safety, and their family safety.
You have a follow-up question, Heidi?
Yes, I do. And then following that, so a Regina community organization has applied to your ministry to open an emergency safe consumption site after more than 100 people have died from overdoses in Regina alone. What's your opinion on these sites? And Minister, will you be supporting this application?
I haven't seen the application myself, Heidi, but this would be something that we would be reviewing through a budgetary process. I know Saskatoon Prairie Harm Reduction has also approached us last year. This is something that we'll be looking at through the budgetary process to see what we need to be able to implement as far as harm reduction and what programs are going to be the best fit for what we need in all of our cities across the province.
We'll take our next question.
We have Mark Smith with CTV.
Hello. I'm just wondering if you could clarify maybe some of the measures that are in place heading into Christmas. We've heard some people confused about households and whether that means their kids that are at college can't come home for Christmas or things like that. I wonder if you could just clarify what exactly are the restrictions going into the holidays.
Yeah, thanks for the question. And, there was a change from the recommendations on 27 November to the recommendations on 14 December. So first of all, I'll just reiterate what Mr. Merriman said, that, all the people I've talked to, understand the new measures and have said that, usually their children may come and visit. This year they're not visiting. They'll connect virtually, or if they have a friend or family member in the same community, they may go out for a walk and meet each other there. But, people are sticking to their households. Adults who live alone or a single parent with minor children can connect to one household. Similarly, if there's co-parenting arrangements, they remain. If there's caregiving arrangements for children or elder care, that remains. Children who may have been away because they may have been billeting or they may have been at school, their primary residence still is with their parents' house because they may not be living independently yet, so they obviously are able to come home. So, most people have a clear idea of what the new requirements are, and the vast majority have actually said that, it is different, it is difficult, we understand the risk, because if all of us started meeting even one or two households, we would see a second spike. So all the people I've talked to actually do understand the new measures and are, thinking of innovative ways to remain connected, either virtually or if they live in the same community, maybe outdoors, going outdoors for a walk.
You have a follow-up question, Mark?
Yes. Who should people contact if they are concerned about someone not following the public health measures? Do they contact the police? Do they contact the ministry? What should they do in that situation?
Maybe I can make an initial. I think for most people, I think that should not be a concern. But obviously, if there's a large gathering happening that looks very unusual, obviously there are numbers on the COVID-19 website to call and express your concerns. But again, this downward trend that we've seen over the last 3 or 4 weeks, there have been very few fines and enforcement orders issued, and I think this has been through voluntary compliance by the vast majority of the population. And I think that is what has worked in Saskatchewan for the most part, and we really hope that that is the approach that will continue to work. And I think, and at the same time, we have to understand that on occasion there may be some of those situations which I described, where a person may be coming into a household as a child who's returning home from school, or other arrangements that are appropriate for that situation. So just to be understanding of that as well.
We'll take our next question on the line.
We have Zach Viseras with the Star Phoenix.
Good afternoon. This is a question for Minister Merriman and perhaps also Dr. Shahab. Mr. Livingston mentioned just a second ago that rapid point-of-care tests were available for correctional staff in Saskatoon. I'm wondering, though, given the number of cases we're seeing in those settings, whether correctional staff and even inmates might be considered a priority group for vaccination, and if so, at what point would they maybe receive that vaccine?
Yes, we do have the rapid point-of-care testing that are being, I'm working with the Minister of Corrections to be able to make sure that we can control any of the outbreaks that have happened at our correction facility. At this point in time, there's no plan to be able to change our 4 priority areas of distribution for the vaccine, as we've seen that this is certainly the COVID-19 has to be able to, we have to make sure that the healthcare workers, that also that the elderly are protected, because that's where we've seen the majority of the hospitalizations and the fatalities. So not at this time, but we'll continue the conversation with corrections and with Dr. Shahab's office to see if we have to adjust. But at this time, there's no plans to adjust that schedule right now for phase 1.
Do you have a follow-up question, Zach?
Yes, on a different matter, the holidays are unfortunately a difficult time for many, and a recent survey that included some data from Saskatchewan showed that instances of anxiety and depression did increase among Saskatchewan people when the pandemic arrived in the province, whether that's because of the stress it caused or because the impact of measures introduced to stop it. I've also heard from healthcare practitioners that while virtual care has been useful in some cases, it hasn't allowed them to reach everyone they need to reach. I'm wondering if your minister, has any plans to maybe invest substantially or improve mental health services going into 2021, given the mental health impacts of this pandemic that we're seeing.
Yeah, you're absolutely correct on this, Zach. There's certainly the physical impact of COVID, and then there's the mental health side of things that is impacting us in ways that we probably haven't even been able to grasp as of yet. This will come on in the future, or some people may be experiencing, especially around the holidays, which is a very happy time of year for a lot of people, but it's also a very challenging time of year, especially, as I mentioned at the beginning of this, people that have lost loved ones because of COVID. We're continuing to look at exactly what we need to do as far as our mental health and or addictions to be able to help that. We do have extra money set aside if there is something that we need in the foreseeable future, and we'll continue to work with Minister Henley and his minister's office to be able to address any of those needs on an ongoing basis.
We'll take our next question on the line.
We have Fakea Beg with Canadian Press.
Hi, this question is probably for the health minister. I know he mentioned earlier that this is a follow-up on how vaccines are being distributed to inmates. I know that you said that you have no plan, but even like, even if we're talking like hypothetically, maybe not in phase 1, but can you elaborate a little bit more on sort of at what point would inmates get vaccinated?
Thank you. Thanks for the question. It's hard to say right now on where that would land as far as the sequencing. Again, we're targeting the areas that we feel that either have the greatest impact of catching COVID, which is our frontline workers in the COVID, long-term care staff, long-term care, obviously people that live there, and in the far north, we're looking at anybody over the age of 50. Those are the ones that we've targeted, that we've laid out. Is there options for adjustment on phase 2? It's hard to tell right now because we're just starting at the beginning of phase 1, but we will consider it based on what the needs are at that specific time, and we'll also determine that on the amount of vaccines that we have flowing into the province, whether we have, obviously we have Pfizer now, if we have Moderna, if other vaccines. It'll all be taken into consideration of where the hot spots are that we're seeing within the province. I won't say that we won't do it, but I will say that it'll be under consideration for maybe in phase 2.
Do you have a follow-up question, Fakea?
Yeah, can you also, I know you sort of addressed this a little bit earlier as well, but I was just wondering if you can elaborate a little further on what is being done to curb outbreaks in correctional facilities right now?
Maybe Scott might be better to address that on the specifics of that, but we do have the point of care testing. We were working in that. And we're making sure that that they are adhering to the public health guidelines as much as they possibly can. Obviously, it's a different environment in there where there was a lot of close contact. So we're making sure that that if there is any close contacts, that's minimized. Scott, I don't know if you have anything else on corrections, what we're doing with them.
So I'd just add to what the minister said. I mean, as far as the outbreak protocols in correctional facilities or any communal level facilities, we are, as the minister said, making sure that what's happening inside the facilities, both for the staff and the prisoners, are adhering to the public health orders as much as we can. We're doing infection control audits, as well as ensuring that PPE is being properly worn and surface cleaning is done. All those things that we do everywhere else, but it is a little more challenging, as the minister's already pointed out, in large facilities like this. But public health has been on, and again, is working with corrections on testing. The only other thing I would add is, and again, not for the inmates, but from the staff in all correctional facilities across the province, Saskatchewan has had made available since July 14th open testing for all residents of the province, including guards and other staff in correctional facilities that could come for testing at any time, whether we had point of care testing available. But that's the other component of it, is moving forward with supporting correctional facilities with point of care testing to ensure that we get on the chains of transmission early and screen staff as well to ensure that the virus is not walking into the facility.
We'll take our next question.
We have Britton Gray with CJME.
Hi, I'm just looking for clarification on something the health minister said earlier. We just want to know, so are you essentially saying that there's not going to be any real enforcement this Christmas season when it comes to the restrictions, that you're just kind of hoping people follow the rules? Because we're seeing all over social media and stuff, people are saying, I'm having people over, I'm having parties, we're not going to follow the rules. Are you going to have police out there enforcing these restrictions to ensure that we don't see an outbreak like we did after Thanksgiving?
Well, just a clarification, I never said, I don't recall saying that we were going to do enforcement. We are very much relying on the people of Saskatchewan for compliance, and as Dr. Shahab addressed, our weekly 7-day average went from 263 down to 217 with minimal enforcement. So it is working with compliance. People in Saskatchewan are complying, and the numbers are starting to come down, and I'm hopeful and I'm very optimistic, and I have a lot of faith in the Saskatchewan people to be able to make that they will be able to adhere to these guidelines, even though they are challenging over the Christmas time, and we all recognize that. The people of Saskatchewan will be adhering to that. If there are people that are flagrantly disobeying the public health guidelines, then I leave that to the police to be able to make those decisions on whether they, what action that they should be taking.
You have a follow-up question, Britton?
Yeah, this is more for Dr. Shahab there. Just from a public health standpoint, how concerned are you about a drastic rise in cases again after Christmas, even with all these restrictions and everything?
Yeah, so, that's a really good point. And like the minister said, even when our case numbers were much lower, 30 to 50 a day over Thanksgiving and Halloween, even at that time we were very concerned, and we did see some, non-compliance with the recommendations at that time. But for the most part, people complied with the different recommendations at that time, and we saw a bit of a spike, but not too much. And now our case numbers, although they're coming down from a high of around 250 to 300 per day to around 217 per day, so the trend is coming down, but absolutely the risk right now of transmission in the household setting is much, much higher than it was over Thanksgiving and Halloween. So, and that's why the recommendations and public health orders right now are very specific. Please do not meet indoors in your house with anyone outside of your own household, apart from those few specific exceptions. If you have someone who lives in the same community, you can, go out and meet outside, go for a walk, meet and greet each other outside. Travel to stay with another family member, things that are common over the holidays are absolutely not recommended or allowed. And I think compliance with this is going to be critical because, we have achieved a lot over the last 3 or 4 weeks while still being able to remain fairly open in terms of being able to have the retail sector open, being able to, be able to go to a restaurant. a lot of this has been achieved through, every Saskatchewan resident taking reasonable measures to keep themselves, their family, and close friends and family safe. And that is going to be absolutely important throughout the holidays. And if we can keep this over the next 2-3 weeks, we will be in a much better position in 2021.
Thanks, everyone. That concludes today's press conference.